Welcome to another episode of Med Madness, where we delve into critical medical topics to enhance your understanding and preparation. Today we're discussing Alcohol Withdrawal Syndrome, or AWS, a condition that can be life-threatening if not recognized and treated promptly. We'll explore the underlying mechanisms, the timeline of symptoms, and the crucial differences between alcoholic hallucinosis and delirium tremens. By the end of this episode, you'll have a solid understanding of how to approach and manage this condition in clinical practice. Next, let's discuss what happens during alcohol withdrawal syndrome. AWS occurs when a patient with chronic alcohol use abruptly stops drinking. Chronic alcohol consumption leads to significant changes in the brain, particularly at the GABA-A receptors, which mediate the inhibitory effects of GABA, the brain's primary inhibitory neurotransmitter. Over time, these receptors become less sensitive to GABA, requiring more alcohol to maintain balance and inhibit the CNS's excitatory signals. When alcohol consumption suddenly ceases, this delicate balance is disrupted, leading to CNS overexcitation, manifesting as the symptoms of AWS. AWS progresses through several stages, each with distinct clinical manifestations. Now let's dive into the specific stages of alcohol withdrawal syndrome. First, there's mild withdrawal, which occurs within 6 to 24 hours after the last drink. Symptoms include anxiety, insomnia, tremors, excessive sweating, and palpitations. Despite these symptoms, the patient remains alert and oriented during this stage. Next is the seizure stage. Within 12 to 48 hours, some patients may experience single or multiple generalized tonic-clonic seizures. This is a critical period where vigilant monitoring and appropriate treatment can prevent further complications. Following this is alcoholic hallucinosis, also emerging within 12 to 48 hours. This condition involves visual, auditory, or tactile hallucinations. Unlike delirium tremens, patients with alcoholic hallucinosis are typically fully oriented and have stable vital signs. With appropriate treatment, primarily using benzodiazepines, these hallucinations usually resolve within 48 hours. Finally, we have delirium tremens, or DT, the most severe form of alcohol withdrawal. DT typically begins 48 to 96 hours after the last drink. It's characterized by confusion, agitation, fever, tachycardia, hypertension, and severe autonomic instability. DT can be fatal if untreated, with a mortality rate as high as 5%. The cornerstone of treatment for AWS is benzodiazepines. They enhance GABAergic activity, helping to restore the inhibitory tone in the CNS. Early intervention with benzodiazepines is crucial to prevent the progression to seizures or delirium tremens. It's also essential to avoid antipsychotics like haloperidol during this time, as they can lower the seizure threshold, exacerbating the risk of seizures. To illustrate these concepts, let's consider a real-life case study. A 45-year-old man with a history of chronic alcohol use is admitted to the hospital for a surgical procedure. On the first day, post-operatively, he is calm and cooperative. However, by the second day, he becomes agitated, tremulous, and is observed sweating profusely. His blood pressure and heart rate are elevated, and he reports seeing small animals scurrying around the room, classic visual hallucinations associated with alcoholic hallucinosis. Recognizing the signs of alcohol withdrawal, the medical team promptly administers benzodiazepines. His symptoms stabilize, and the hallucinations resolve within 24 hours. The early intervention prevented progression to more severe withdrawal complications, demonstrating the importance of timely recognition and management. In summary, alcohol withdrawal syndrome is a serious condition that requires prompt recognition and treatment. Understanding the progression from mild withdrawal symptoms to potentially life-threatening delirium tremens is crucial for effective management. Remember, benzodiazepines are the mainstay of treatment, and early intervention can make all the difference. To solidify your understanding, we encourage you to engage with our pre- and post-podcast quizzes and review the Anki Flashcards we've prepared for this episode. These tools are designed to reinforce key concepts and ensure you're well prepared to handle AWS in clinical practice. Thank you for tuning in to Med Madness. Stay sharp, stay prepared, and we'll see you in the next episode.